All right, hi. We're gonna go over some breathing techniques and some coughing techniques. The first one is gonna be posture correction with inhaling exercises. So the first one for that is cervical extension. What I want them to do is breathe in as they bring their head back, and then breathe out as they bring their head forward. So it'll look like this. Okay. Once they've mastered that, we'll move on to the scapula. So we're going to go, same thing, it's going to be breathing in and out, but as they breathe in this time, they're going to retract their shoulders back, and as they breathe out, they're going to bring their shoulders forward. So it'll look like this. And then once they mastered that, we'll move to shoulder flexion. So again, be the same thing, breathing in and out, but as they breathe in this time, they're going to bring their arms up, and as they breathe out, they're going to bring their arms down. So it'll look like this. Once they've mastered that, we'll move to a different positioning that we can do to open up the airway. So you'll need a little towel roll or a bolster or anything that you have. You'll just lay it down and then have them lay across it. So it's going to go between their scapula, and they're just going to lay on it for about 3 to 5 minutes, however long is comfortable for them. And they're just going to hang out there. It's opening up the upper chest. And then you can also do it sideways, where you turn it long ways, like this direction, or not long ways, perpendicular. And you're going to lay on the side that is deep in it, and it's going to open up this airway right here, or that side right there. Some other things you can do is a myofascial release. So as they're laying on their side, you can bring their arm up over their head, and you can stretch open and then just pull down. So you're mobilizing the fascia a little bit and helping release everything. You can also do some rib mobs on there too. The diagonal lifting for the PNF pattern, it'll just be this direction, so it'll be the sword. So they're going to breathe in and out, so they're going to be laying down again. This time. And as they breathe in, and then as they breathe out, so you can also do it with both arms, or you could even do it sitting up. Positioning to help them with breathing. Again, another one could be while they're laying prone on their elbows. So they're here, and if this is uncomfortable, you can put a pillow right through here, but they're just breathing in, out. So same thing, they're lifting their head up as they breathe in and out as they breathe out. So sitting upright or standing helps elongate the chest. So as long as they're sitting upright super well, and then just normal breathing. And then the tripod position, so they would be standing, they can put their hands on their knees like this, and that is considered the tripod position. They can put their hands on something to help with it, and it just gives them a little extra support and use of their accessory muscles to help with breathing. The butterfly technique can be done in sitting or standing or laying down, but you're going to put your hands behind your head and make yourself look like a butterfly. And as you breathe in, you're going to open your elbows up, and as you breathe out, you're going to bring them back in. So for the lower costal breathing, while you can do this while laying down, sitting up, standing, or during physical activity, but how you're going to teach them is they're going to put their hands on their lower ribs or right by their diaphragm, and you're going to apply a little bit of pressure. And you're going to tell them to try and breathe into your hands, so try and make your hands move. So it can be kind of hard at first. Another way you can do it is if you have them lay down, you can put one hand up here at the top and one hand at the bottom on the diaphragm again, and you tell them, I only want this bottom hand to move, nothing at the top. So Or if they really need something to visualize, you can put a Kleenex box or a towel or something. For exhalation, it will be the pursed lip breathing. So it's kind of what I've been doing already, but it's like blowing out bubbles. So you're gonna breathe in and make your lips into a circle and blow out. It's kind of a long inhale in and a long exhale out. And then pace breathing is while they're doing physical activity or they're just learning to breathe again, you have them count. So they'll breathe in for 2 seconds and then they'll breathe out for 4 seconds. So it'll be sometimes you'll have to count for them because it'll be too much to count while they're trying to figure out how to breathe in and out. So moving on to coughing techniques, the first one is going to be a huff coughing. So in order for them to learn, you can take a little tissue, or you can, if they have glasses, you can use glasses. But basically, they're going to breathe in, and then they're going to make the word huff come out, and it's going to blow the tissue. Go. So that's for them to understand how they're supposed to be doing it. The coughing techniques is going to be flex breathing. So again, the flex breathing is just how they're sitting forward. This is helped using more of the abdominal muscles to help get everything out. So it's just so while they're more in that flex moving forward position. Splinted coughing is going to be with a pillow. So it's going to usually be post-op pain, people or anybody who had a cabbage. So they're going to put the pillow right over the incision, apply some pressure, and when they cough, it should minimize the pain that they have, and it should keep them a little bit more steady. So it should be like that. And breath stacking. So they're going to breathe in a total of 3 times before they fully breathe out. So it'll be they're going to get to the top. Once they get to that third breath, they're going to need to actually exhale. Some assisting techniques that we can do or they can do themselves. The one in supine, so they're going to be laying down, and you're going to put your hands at the lower costals, again, or at the diaphragm, and you're going to apply pressure. It's going to be down and out. So they're going to inhale, and as you press down and out, so this helps the abs work a little bit more. And the other one is the Heimlich. So it's the same thing as what you would think about with the Heimlich. So it's going to go right at the diaphragm, and you're going to push in and up as they cough. So it's kind of hard for them to learn and for us to learn too, so we have to practice it and let them practice it multiple times too. You can also do this one in side lying and the Heimlich in side lying. The other one in side lying is while they're laying kind of on their side. So their hips are forward and their shoulders are back. And as they inhale and cough, you're going to throw their shoulders forward. So it'll be like that. Okay, so that helps move the secretions up and out. Some self-sits that they can do would be, one is going to be laying on their elbows again, so on their stomach and elbows. So it's going to be the same thing as with the breathing, but just this time with the cough. So they're going to bring their head up as they inhale, and cough as they bring their head down. So this will help get the secretions out. The tetralong sitting, so they're going to sit with their arms behind them like this. And again, they're going to use their head and a little bit of their shoulders as much as they can. So they bring their head up and throw themselves forward. The paralong sitting, so now they can use their arms a little bit more. So they're going to do the butterfly technique. So they're going to and really throw themselves forward to try and get them secretions out. Then the short sitting, they're going to be sitting up on something, They can do the Heimlich type thing, or they can do the cautious running, whichever one is more comfortable for them. But basically, they're going to do the same thing. So they're going to inhale and really throw themselves forward when they cough. And then the last one is the counter rotation. So this one, they're not going to be silent. They're going to use a diagonal that we used earlier for the breathing technique. So they're going to take their hands, they're going to and throw themselves forward and down to the side to throw it back. Those are all things they can do by themselves. Let me just make sure I didn't forget anything. I think I'm good. So thank you.